Hello and welcome back to APTA Next here in Chicago, Illinois. My name is Kyle Stapleton. I'm the Director of Communications of the APTA Student Assembly Board of Directors. And here I have the pleasure of being joined with Alan Jette. He's the Editor-in-Chief of the Physical Therapy Journal, the official journal of the American Physical Therapy Association. So Alan, thank you so much for joining us today.
My pleasure, Kyle. Thanks for having me.
It's my pleasure. Awesome. So can you tell our viewers just a little bit about, being Editor-in-Chief, what your daily duties are?
Yeah, it's really an interesting position. I would say on a day-to-day basis, there are very few days that go by that I don't do something having to do with the journal. All the manuscripts usually cross my desk, and so on a daily basis, I'm looking at several manuscripts to see what the editorial decision will be. So I do that on a daily basis, but I think my overall responsibility is really to help set the direction for the journal. And we don't do that on a daily basis,
right.
But that's something that is always in the back of my mind in trying to figure out what's the best direction for the journal to be taking.
Absolutely. And when we talk about research, how does research base our clinical decision making without every move that we make, influencing every move that we make?
Yeah, it's a good question. It's one that comes up all the time. People don't want to practice following a cookbook. They feel really offended by that.
Right.
And evidence-based practice is not cookbook practice. Evidence-based and clinical practice guidelines really help the clinician know what approaches to treatment can be supported by scientific evidence. And that's a guide, that's not a prescription.
Right.
The critical part that physical therapists have to do is to do an appropriate diagnosis so that they know what the appropriate intervention will be. And connecting one versus the other is where real clinical judgment comes in. And the other thing is that clinicians have to take into account the individual that they're working with, their unique circumstances, and their environmental context. Mm-hmm. So the evidence helps us move in the right direction, but it's by no means definitive or cookbook.
Right. Talking about students here, what are some tips that you would give to first-year physical therapy and physical therapist assistants students who are new to utilizing research?
New physical therapists today and physical therapy students have tremendous advantages that I certainly didn't have when I came into the field. There are resources available online that allow you to stay on top of the literature. For example, in physical therapy, there's the Pedro compendium of evidence in physical therapy, which provides systematic reviews and evidence that's available for major physical therapy interventions. And that's readily available to any physical therapist. There's the Cochrane organization that was started in Britain back in the 1990s, and they now have a Cochrane rehabilitation. And that's available online for rehabilitation specialists to help you stay on top of the literature that's available out there. So those are two off the top of my head, tremendous resources. The other thing that we publish in the Physical Therapy Journal clinical practice guidelines, and so they're available. You can find them on the website. And we also, on a regular basis, publish systematic reviews that look at a summary of the available evidence and evaluate its quality. So clinicians don't feel they need to search out all the original evidence. There are ways that it's summarized to make it more available for busy clinicians.
Amazing. And lastly, what ways do you see research shaping clinical decision-making as we move into an era with new technology capabilities and advances?
This is a really exciting area for clinicians who are working in contemporary practice. This artificial division of research and practice is beginning to go away because technology is making it more feasible for clinicians to actually collect information and data that allows them to ask questions about their practice, to guide their practice by analyzing the evidence that they can actually collect, working with researchers. And so I think you're going to see more of that in the coming years, where the technology will make it much more practical for clinicians to collect information about their patients, summarize it in aggregate form, and to use it to ask really important clinical questions. I think it's we're scratching the surface of what's going to be possible in the future.
We're seeing the tip of the iceberg right now.
Absolutely.
Awesome. Alan, Jette, thank you so much for coming on and joining us today.
My pleasure. Thanks for having me, Kyle.
Awesome. And we'll be back with some more interviews here at APTA next.